Chegamos aqui, estou ao lado do Josier
Good
Vilar,
afternoon. I
presidente
am
e
here,
fundador do
close to
FII
Josier
Digital. A
Vilar,
gente está num momento super
chairman and founder
propício
of
para isso, por essas
FIS
conexões, tudo isso
Digital.
que a
This
gente
is a
tem
very
feito,
favorable
temos
moment for all these
observado
connections, for
China,
everything we've been doing with
Espanha,
China,
todos esses
Spain,
países
and
conectando de
all
alguma
these
forma.
countries
O
getting
que você acha
connected in
que
a way.
aconteceu de manhã?
So,
Pode passar
what
um
do you
pouco para a
think
gente
happened
como você
this
está
morning?
sentindo? Você está feliz
And
com
what
tudo
do you
isso?
feel? Are you happy with everything? Oh, extremely. I'm very, very happy. So, André, it would be worthwhile having a new FIS soon to discuss what we heard. Because of the experience, first of all, there was an opening conference with Marcelo Glazer that was very, very interesting, sensational. He's the best. He's an ace. And while he was talking about the world that is getting closer to all of us, talking about the importance of us valuing and qualifying people, so he brought together science with social responsibility, economy with social development. Well, the human look, but without being too sentimental. South Korea did this, invested in science, technology, research, and this is the recipe for Brazil to start growing again. We must believe and value, and at the same time also praise science. Today we heard the good news that there may be a vaccine that will soon arrive with 90% efficiency and might be effective. So we talked about this in the morning. China mentioned the China presentation talked about the relevance of industrial development in China and how Brazil and then people on the panel, Gadelha, Pedro Westphalen, Senator Ana Amelia, brilliantly discussed how Brazil may win the development and sustainability of industrial development. When the industry reducing economic dependence that we have from foreign countries, we need to incentivize research in our country. As Marcelo Gleiser said, we can't just be a reference country in deep water prospection or in agribusiness as a reference. And so we need to expand that. We have an installed capacity in terms of the academia, universities, research organizations. It's really major. We have huge potential. And lastly, Spain talked about how they have been built capacity, trained, and provided education to healthcare professionals with a strategic plan of demands, catering to the needs of the Spanish population and trying to match supply and demand. So it was a glorious morning. I'm very happy with what we saw and heard this morning on the first day of our forum. So today and on Wednesday, I'm inviting everyone to be with us because we will have more and more people talking about very interesting stuff. So we'll be able to talk to André Machado and Manoel Peres from Fleury Group, and you are here instead of Daniel Sorans. I'm going to replace Daniel Sorans, who was a former head of the health department of the state of Rio de Janeiro. Brilliant. He's a researcher, and he's a doctor too. He had another simultaneous commitment, and unfortunately he couldn't be with us. We're going to miss him greatly, and I'll try to replace him. But with André and Manuel, there's no problem. Everything is going to be fine because they're really great. Very good. Good afternoon, Josier. It's a great honor to be here with you and André in the Health Innovation Forum to think about Brazilian health with the theme populational health management. Before anything, Josier, I would like to say, first I would like to introduce André. Well, you don't need to be introduced because you are leading FYS. I don't need to introduce you to the listeners, everyone connected with us. They know you already. And if you allow me, I'm not going to introduce you. And I'm very briefly introduce André Machado, playing my role as a moderator. André Machado Júnior is the CEO of AsQ, a health management company. He has a background in business administration, an MBA, and human resources management. André Machado has more than 20 years of experience in administration management, has worked in major companies before he became the CEO of AsQ. André Machado has also worked for 6 years in quality director of operations in health and market relationship. André, thank you very much for being here. You're most welcome to this conference that Josier has organized. Talking about population health, before anything we must say, Josier and André, of the dilemma of medicine regarding what we see in terms of population health, which is the need people feel versus the perception of health managers in terms of what necessary to improve health results, health outcomes, and indicators. This must be one of the first dilemmas, dilemmas that will become even more complex in the times we are going through, considering all these months of social distancing. The second major dilemma of medicine, and it's not necessarily second in the hierarchy, is to define care to populations versus, and the needs are endless, and we have resources that are limited. And this is part of the equation of population health. But I would like to say, when André talks, and when you talk to a problem that in population health management is engagement of people in the programs of continuity and follow-up of those people's population management. And then there is a question on the air for those who are connected with us to think about it. What works? In terms of engagement, what is the best thing that might facilitate engagement? It's a shame Daniel is not here with us because he's very experienced in public healthcare management. And this would be an interesting question to ask. So what works in terms of engagement? Another point in this context is what about the use of information and data considering the GDPR? And then I'm going to mention my comments about everything. And this regards the health data that are necessary for the manager to manage appropriately population health. And I'm going to give my first opinion. I think that the limitation of physical space and the limitation of populational contingency for appropriate management is kind of key. It's impossible to embrace large populations all at once to manage, neither very, very big space. That's why I go back to basic public health concepts. I'm still in favor of silos when local healthcare systems of assessing the access capacity of people to healthcare services and geographical features of the population and its distribution. Another important thing in population health are those related to longevity. So more and more as the population ages, the aspect of longevity has been mentioned as a desire and longevity with quality, of course, a desire and a concern of people which is longevity. But then, on the other hand, in terms of management of healthcare costs, is how to manage healthcare costs. And I am making a provocation. There's no other way than appropriate management of what we call major complex cases. In other countries they call catastrophic cases, in order to reduce healthcare costs, because those are the cases that really cause a distortion in population health indicators and even in healthcare costs. And lastly, still going to a closing, of course, we can think of population health management, Andre, without thinking of the main diagnoses that need continuity of care, such as hypertension, diabetes, rheumatic, COPD. But today, with the evolution of immune therapies, especially in the pharmaceutical industry, and cancer. Cancer today is a disease, many of them, fortunately, that have become a chronic disease. So there is continuity of care, and therefore there is an evolution of population health care costs that is considerable in taking care of cancer. And so we need to provide to these people longer lives with quality so that they may have access, appropriate access to all technologies. Additionally, I think that isolation will bring up this aspect, which is mental illness, particularly depression and anxiety, and more recently have been very much talked about. And gradually it's been changing, and it's coming up in the profile of population health management. To make matters worse and everything more complicated, we cannot fail to mention the issue of patients' rights. The patients' rights to decide, to participate in care. And André has experience, and that he may share with us and bring this into the debate, is the patient's right to decide versus interventions that are possible by the population health manager. But of course, the major challenge is to improve indicators and also how to think of the cost effectiveness of new therapies, new technologies. Not to say that there are no additional complications, these are the only ones that we can mention. Unfortunately, we have healthcare services that is very fragmented, and this fragmentation is one of the additional elements or one additional challenges in population health management. So these were the relevant points that I wanted to mention for this very brief debate that we are going to have now. Oh, great. André, your turn.
Manoel, você trouxe vários pontos.
Well, you have mentioned many things. First, I would like to thank for the invitation.
Grandes nomes aí.
So we have major names, and then we have points that make population health management, that make it very complex. So if we look at the data that we have about healthcare today, if we look at private health, we have 47 million people using supplemental health. For public health, we take the population of Brazil today, is 209 million inhabitants in Brazil. So, and then we can calculate the other part of it, all included in the AsQ. And we see how much the data in health that leads us to think more and more about everything that you have mentioned, from population aging. And we know that in 10 years' time, studies show that we are going to have 3 times more people above 60 years of age. Even coronavirus, that is a new factor that has changed greatly the mode of work
e para ajudar na parte da assistência, né, que
that
foi a
has
telemedicina.
brought in a
Mas a gente
new
se
way
pergunta,
of
né, qual que
working,
é a
which
melhor
is
relação aí,
telemedicine.
como a gente
And we
consegue cuidar
wonder
melhor
what is the best
da nossa
relationship, how
saúde
can
e
we
fazer
best
uma
take
gestão de
care of
saúde
our
populacional
health and
respeitando
to
de
have
fato
population
o
health
que a gente
management
escuta tanto falar
effectively
aqui por aí,
respecting
né?
what we
Da parte
hear
de atuar nas três linhas
in terms
diferentes,
of
nos três
working on
pilares
three
que para
front
mim são os
lines, the
mais
three
importantes para
pillars
se
that
olhar
are
para
the
a
most
saúde, para a
important
gestão da saúde
when we
populacional.
look at
E a gente
population
precisa
health
cuidar,
management. And we
melhorar
need to be careful
totalmente
to
aí e atuar na
improve
melhora da saúde
and
da
to work
população
to
que é
improve
gerenciada,
population
e aí eu
health
concordo contigo,
and manage
nos
it. And I
silos, né?
agree with you
Nas
about the
equipes, na
silos and the
quantidade
teams
certa para
and
aquelas
the
equipes
right
de
numbers
gestão
so that
conseguirem
management
dar uma
teams
ênfase e
can
ter uma atenção maior.
provide emphasis and
Depois
better
vem muita
care.
experiência,
And
né?
then there's
E
the
experiência, que
experience.
para mim é um ponto extremamente
Experience
importante
to
para o
me, this
engajamento,
is
que foi uma das
extremely
coisas que você
important for
trouxe aqui.
engagement, is
Qual que é a
one of the things
experiência
that
que
you
de
mentioned.
fato
What
o
is the
usuário do
experience that
serviço ele tem?
users have?
Aquela entrega fez
So
sentido
user
e faz com que ele
experience.
queira dar
Did the
continuidade no cuidado
delivery
que ele
make
está
sense, and does
tendo,
it,
né?
or did
E
it
do
make them
acompanhamento que
want
ele
to
tem com
continue
aquela equipe de
or follow
medicina que o
up the
acompanha e que
care with the
gerencia a
same
saúde
team?
populacional dele. E por fim,
And
o
lastly,
que tu também trouxe, né? Que a gente
what you
sabe
have
que tem
also
que trabalhar para
mentioned,
ter um custo
that we
benefício
need
melhor,
to
porque o
work to
dinheiro é
have better
finito, né? Não dá
cost
para a gente fazer
effectiveness,
tudo
because money is a limited
todo tempo.
resource.
E a
We
gente
can't
sabe que
do
tem uma
everything
onda
that we
grande de
want all the
desperdício que dá
time,
para
and there is a
atacar
wave of
fortemente
waste
por
that
meio da
we
gestão
can
da saúde populacional.
strongly tackle by
Entrando nas três
population
esferas, eu
management.
vou me permitir
Going on
falar
to
um
the
pouco
three
aí
spheres,
em
I'm going to
relação
allow
a
myself
esse
to
engajamento,
talk a
que é a
little
sua
bit about
primeira pergunta.
engagement and in
Quando a
answering
gente fala
your
muito
first
desses
question.
três
So
pilares
when
de
we talk
atuação para
about
de
the
fato ter
three
uma
work
gestão de saúde
pillars,
populacional, para mim o primeiro passo a
so
ser
the first
dado é
step to be
estratificar
taken is
mesmo,
to
olhando
stratify
para o perfil
and
epidemiológico,
look at
demográfico, a
the
população que é
demographic
cuidada
profile
por
of
aquela
the
equipe, né?
population that
Quando a gente
that
olha
team looks
para
after.
alguns dados
So
até de
when we
exterior,
look
e a
at
gente tem estudado um
some
pouco isso, né,
data,
para os modelos de
even
AsQ, adaptando ele
from overseas,
para o modelo que a
and
gente
adapting
consegue também
it to a
praticar
model
dentro do
that we can
Brasil,
practice in
mas quando a gente
Brazil.
traz
And when
o
we
objetivo da
see
atenção
the
primária, de
objective of
cuidar da
primary
população
care,
como porta de
of
entrada e de
being the
coordenação de
gateway
cuidado
and the care to
para os
the
outros
population,
elos de
coordinated
prestação de
care
serviço que
in
aquela
the other
pessoa vai
links
precisar,
of
que aquela população vai
healthcare
precisar,
that the
para
population
fazer
will
o
need,
direcionamento
and
correto e atuar
to
no
give the
engajamento das
correct direction
pessoas, eu
and
preciso
work on
saber
people in
exatamente o
engagement,
que
we need to
elas
know exactly
possuem.
what they
E
have
qual que está, né, dentro da minha linha de
and
cuidado,
where
como
it
que está
is in
estratificada
my
para eu
line of
separar.
care
E
and
aí
how
eu vou
this is
falar de um outro ponto que você
stratified.
trouxe
And
também.
I'm going to mention
Nessa
another
separação
point
eu
that
vou
you've
saber,
mentioned.
eu
In the
preciso saber quem
separation,
são os
I
meus
need to know
crônicos e
who
quem são os meus rígidos. Cada um tem um gatilho
are
para
the
entrar num processo
healthy
de cuidado
people
diferente.
and who are the
Hoje eu
sick people.
me
So
gerencio, né,
today I
na
manage
saúde
myself
com
in
um
health.
médico de
I
referência. Eu
have
tive
like a
uma
reference
consulta com um
doctor.
enfermeiro da equipe dele na
So I had
sexta-feira
an appointment
que
with a
ativou
nurse
alguns
of his
gatilhos de
team
meta de coisas que eu precisava
that
cumprir daqui para frente para continuar o
defined
meu
some
cuidado.
triggers
E isso a gente
for
vai
me to continue
combinando o
my
jogo,
care.
né? Então,
And
quando
we
tu
agree
envolve
on
a
that.
pessoa
So when you
no objetivo,
involve the
quando tu
person
conhece o
in
perfil
the
dela,
goals and
envolve
you
ela no
know the
objetivo que
profile,
ela
involve
precisa
them in the objectives that
seguir
they need to
e
attain,
combina as metas que ela
and
precisa
agree the
ter, eu
goals
acho que
that
aí
they
tu
need
consegue
to
trabalhar no
pursue,
engajamento,
you can work on
né, para que ela
engagement
siga e
for
faça a linha
them
de
to
cuidado. E a
continue
partir da
and follow on with
estratificação, né,
care.
que a gente
And
faz
based on
para identificar
stratification
e
that we
conhecer
do
melhor
to
aquela
stratify and
população,
get to know
tu vai
better,
atuar na linha de cuidado com
so
cada
we go
condição de
in the
saúde
line of
existente
care,
e em cada
considering
etapa da vida que a
existing
pessoa vai
health
seguir.
problem.
Isso é gerir a saúde
It
populacional
means manage
como um todo
population
e
health
atuar
at
nesses três pilares
large
que eu
and
comecei
work in
trazendo
these
aqui.
three
Então, para mim,
pillars that
Manoel,
I
esse é o
have brought
primeiro
to share
passo.
with
Assim,
you.
acho que a gente tem que
This is the first step,
conhecer
in
bem
my
esses
opinion.
objetivos,
Get to know our
esses pilares da
objectives,
gestão de saúde
get to know
populacional,
the pillars
trabalhar
of
fortemente nessa
population
estratificação
management,
e
work
nesse
in
cuidado dessa
stratification,
quantidade de
and
população que é administrada por um elo, por um silo, por um
just
grupo
care for the
de
population
serviço.
that is managed
E aí,
by
por
a
meio
pool
desse
of service
conhecimento, eu
provider,
consigo,
and
dentro da
through
linha
knowledge,
de cuidado de cada situação, de cada momento, seja
considering
de uma gestão de
every
casos,
moment
seja de uma
of
gestão
case
de
management
rígido,
or
conhecer mais a
cluster
pessoa e
management,
começar a
we'll get to know
engajá-la
more the
para algo que
people
faça sentido para ela, para que
and
ela tenha de fato
engage
uma
the
experiência
person
positiva.
into something
Esse,
that
para
would
mim,
make
é o nosso
sense and
pontapé
result
especial, tá?
in a positive
Trouxe algumas coisas
experience.
que tu comentou, não sei se tu quer abranger já
I've brought
outras, se a gente
some
passa aí pro Josier
things
falar um
to
pouquinho
you. I
também.
don't know if we'd rather hand it over to Josier or what.
Não, eu acho, André, que
No, André, I think it's good. Maybe you can draw your conclusions, and then we can just hand it over
Claro,
back to
com certeza.
Josier.
Então, quando a gente faz, Manoel, a parte de certificação que eu comentei, né, eu já
When we
respondi aos
have this kind
objetivos
of
setados.
stratification, and I
Estou
have
com o
set
modelo,
the
hoje a gente está
objectives,
dentro do nosso país num modelo que é utilizado muito mais
in Brazil, we use a
direcionado
model which
para a
is
utilização
all
mesmo, as próprias
directed to
pessoas, né, nós aí enquanto
utilization
beneficiários do
as
serviço, a gente
beneficiaries
acaba
of the
buscando
system.
uma utilização maior do que é necessário,
And
então eu
we
vou
tend to
busco,
overuse a little bit.
entendendo que eu estou com uma dor, com uma necessidade extrema,
I understand
eu
I
vou
have
para
an
aquele
extreme
caminho
need, so I
sem ter um
just go
direcionamento
to
melhor.
one direction, even
Então, para mim,
without having any
grande
specific.
Ok, o grande ponto para a gente avançar na
The
mudança
main
e para
point to
atuar
move
mesmo na gestão da
ahead
saúde
and to
populacional
work
é
in
ter em mente que a
population
gente precisa mudar mesmo o
management is to
modelo
bear in
de
mind
atuação em
that we
saúde,
have
né?
to
Sair
change
muito desse
the
cenário que a
healthcare
gente tem que estar
model
centrado
to go
na
from
doença e partir
a
para um modelo centrado no
disease-centric
cuidado em
model
saúde,
to a
onde eu posso trabalhar mais na
healthcare
promoção
model where
e
we
no
can work on
acompanhamento
health
aí por
promotion
toda a etapa de vida que as
and
pessoas tenham, né?
support
Que aquela
throughout the
população que eu
whole
cuido tem e que
lifespan
vai ter durante o
of
seu processo de
the
envelhecimento.
people, even during aging years. Great. Thank you, André. Thank you for your considerations. Josier, would you like to draw your comments now?
Comentários finais, o menor tempo possível. Já sei que estamos aí com pouco de atraso.
I know we are running kind of late, and I wouldn't have much to add to what you and André have just said. As I'm here on behalf of André Surange, I'm going to talk about the public health. I'm going to talk about the limited access to people of low income. How can we guarantee access to health services of people from low income levels? Probably 170 million of people only use public healthcare services. In the city where I work, Rio de Janeiro, 50% of our city has a private healthcare coverage. The other 50% needs public service. So we have to guarantee to 3.5 million people approximately the right to have diagnosis, appropriate treatment, good follow-up. So I couldn't agree more with Manuel. We have to start working in policy of silos. So why don't we run a pilot? In Rio de Janeiro, we have about 8,000 diagnoses of breast cancers every year. Out of these 8,000 diagnoses, 4,000 in the private service can be treated. 4,000 of the diagnosed in the public service, 2,000 will be treated. The other 2,000 women will have a cancer early diagnosed without having access to surgery or treatment. It's not fair, right? It's not fair what we do with the low-income population. We have to organize the system so much so that information, something that André and Manoel stressed, will be provided to all levels. We should have one single piece of information, maybe digital medical record. So if the woman has a mammogram and there is a diagnosis of cancer confirmed, automatically this patient should be referred to a center where she would be treated in the city of Rio, state of São Paulo, or the Amazon. It doesn't matter. We should guide the patient to wherever there is a availability. And now, taking the best of the upcoming elections in the cities of Brazil, we want healthcare systems to be integrated. One single system of regulation that provides access to treatment, access to diagnosis, and then the low-income population can be served. If we simply keep on as we go without coordination, we are not going to succeed. And this is probably the main challenge of our forum, to propose and foster this discussion. Thank you, Manoel.
Aqui, André, rapidamente, veio aqui uma mensagem
There is a message that was sent to me
veio aqui uma pergunta da Rosenita Mesquita,
by Rosenita Mesquita,
para abordarmos rapidamente
asking
sobre a
us
questão
to
do
quickly
engajamento dos profissionais de
address
saúde.
engagement
Para
of
concluir o
healthcare
nosso
professionals.
bate-papo aqui, Rosenita respondendo
Just
o
to
questionamento, eu diria que,
conclude,
em primeiro lugar,
first
na
of
minha
all,
opinião, vamos ver
in my
rapidamente do
opinion,
André, é preciso a estabilidade de
we
política,
need
estabilidade de
stability
propósito,
of
para
policies
engajar o
and
profissional.
purposes
Esse é o
to
primeiro item. O
engage
segundo
professionals.
item
This is the first
estabelecer bem
item.
as metas para
Secondly, we
aqueles
have to
profissionais na nossa
define
população
goals
ao qual
for
eles estão
professionals
ajudando.
who
E
are
terceiro,
going to
naturalmente,
care for specific groups of
reconhecimento
population.
do ponto de vista
Thirdly,
profissional, enfim, do destaque pelos resultados obtidos, mas também do ponto
we
de vista da
have
remuneração
to
pelo eventual
recognize
saving obtido
the
na
good
manutenção
performance,
da
but
população. Essa é a
also
nossa opinião em
value
relação ao
the
engajamento,
savings
respondendo ao seu
from
questionamento.
the most
André, 20
appropriate,
segundos para responder, então
well
nos pressionando aqui para
coordinated
finalizar o nosso
services.
certame.
So, André, you have 20 seconds
Totalmente
to
de acordo
finish.
em relação ao que você
Well,
trouxe,
couldn't
de
agree
engajamento.
more
Acho que
with
os
you in terms
propósitos
of
têm que
engagement
estarem
and
aí
purposes.
direcionados por mesmo
Everything
objetivo.
should be focused
E a
on
partir
the
do momento que tu
same
tem as metas
goal.
claras,
And
né,
once you have
na
clear
sequência,
goals,
e aí que tu acompanha inclusive elas
and
dentro da
once
população que tu
you
vai
monitor
gerenciar,
them closely
tu
in the
consegue ver o
managing
quanto isso traz
population,
resultado
we
para aquela
can really
população que está
see
naquele
good
cuidado. Então,
results for the
engajamento,
population being
para
submitted to
mim, a
care.
primeira parte vem do profissional
So
mesmo, dele
first,
estar
engagement
dentro desse
results
processo
from
e
professional,
querendo ser
from
o
having
agente de mudança
professional actively
nessa gestão do
involved and
cuidado da
acting
população,
as
e
a
com certeza
agent
fazendo
of
isso bem, ele
change,
vai achar
and
o
by
gatilho da
doing it
população com que ele
appropriately, they
cuida,
are
né?
going to
Pegando
identify
muito
the
aquele pedaço
triggers
da experiência do usuário e do
based
próprio
on the
profissional da
experience
área.
of users and also healthcare professionals.
Muito bem, dessa forma,
Wonderful. With that, I think we come to a natural closure. I agree with André. The experience of healthcare professionals is something essential. It's no use having technology and apps if there is not a technically qualified Brazilian professional doing things. Technology is an important role. Tools are important, but it's not a solution. What solves problems are people. People who are ready and engaged to work. People are key, not technology. Thank you all very much. Thank you, Josier. Thank you, André. Thank you, Manuel.
Tchau, tchau.
Thank you, everyone.